Alright guys, quick chat on explosive and explosive injuries. This has already been covered in your trauma course, so I'm going to quickly talk about the blast injuries and focus more on the CBRNE implications. So explosives are caused when some type of chemical has a violent reaction and gives off a rapid and excessive amount of heat. This violent release of heat can do a lot of things. Big changes in air pressure, loud noises, and that force can throw lots of things around, so think shrapnel and patients. When we think about blast injuries, we can break them down into 4 categories. Primary blast injuries are caused by that rapid change in air pressure and can cause severe barotrauma to casualties near the blast. Look for things like ruptured eardrums, collapsed lungs, or GI bleeding, as that trapped air expands and damages tissues. Secondary blast injuries would be from the shrapnel that's sent flying from the explosion. Think pieces of metal from tanks, dirt, and debris flying around. You can expect all manner of soft tissue trauma, as well as blunt and penetrating injuries. Tertiary would occur if the patient was close enough to be thrown during the explosion. And quaternary injuries would be all of the other explosion-related injuries, such as burns, inhalation injuries, and then exposure, which is what we're going to focus on here. It's that last category which can be particularly important to us from a CBRNE perspective. First of all, explosions can aerosolize chemicals, taking them from their stable liquid or solid form and then spreading them around as a gas. This can make a small incident much larger and can lead to a larger cross-contamination risk, and then the decontamination process is much more complicated. The explosion can also create smoke, which can further complicate the situation, again widening that evacuation zone and requiring more PPE to handle the incident. On top of that, if there are other chemicals around, that explosion could have damaged their containers, and that can lead to an even more complicated chemical incident. Secondary explosions and a further widening of the incident or further contamination are all possible here. Finally, we can talk about the topic of dirty bombs. Dirty bombs are found when radioactive material is placed in an explosive device and its contents are spread with that explosion. While historically there's never been one used, from a potential threat or a terrorism perspective, it's really dangerous. Part of the reason these are so dangerous is because radiation exposure can be silent, but have devastating effects, and they can be transmissible for a really long periods of time. The radioactive material can spread onto other surfaces, so decontamination is exceptionally important in these cases. Signs of radiation poisoning would include nausea, vomiting, hair loss, some dermal burns, and bone marrow dysfunction. So think things like anemia, platelet issues, and the immune response.